So welcome back. Obviously, those of you who've chosen to come to the better of the two sessions, congratulations. Just to remind everybody that the session is being recorded, so please do bear that in mind when you're making comments during our discussions a little bit later on. We are going to ask some questions throughout the course of the discussion, so you will need to join on slido.com. Hopefully you've all got suitable devices to be able to do that. So I just give you a minute to join and then we'll make a start. I'm going to start off with a few introductory remarks, then I'm going to hand over to our two guest speakers. We're delighted that we've got Ellie West with us and Zoe Halfakery, who know far more about sustainability than I ever will, and they're going to lead us through some discussions, hopefully, that will come out with something really useful at the end of it. Okay, hopefully we've all got that. Right, so let's make a start. So when I was preparing some stuff for this talk, I thought what would be really useful was just to get a little bit of information just to set the scene. And I pulled a few figures from the Worldwide Fund for Nature, looking at Amazon rainforests and looking at things like Arctic ice. And we know how incredibly important the Amazonian rainforests are. They're absolutely critical for the health of our planet to help halt climate change. They cover 6.7 million square kilometres of land, which is twice the size of India. And there are within those rainforests 400 billion trees. They store 150 to 200 billion tonnes of carbon. But despite that, we're chopping them down. Deforestation is an ongoing thing around agribusiness, and we've lost almost 20% of our rainforests. That's land the size of France. And with that, of course, not only comes the impact on global health, but also the loss of habitats for so much of the wildlife that depends on it. If we look at the world's glaciers and sea ice, it's melting again due to global warming. A third of the world's remaining glaciers will melt by the end of the century. 95% of our oldest and thickest Arctic ice has already gone. And if we continue at the rate that we are going, by 2040, the Arctic will be completely ice-free. So some sobering thoughts really just to set the scene for our conversations today. We look at our code of professional conduct as veterinary surgeons and indeed as veterinary nurses, our responsibility to the public. We all recognise that we should be ensuring protecting public health, animal health and welfare, but part of that statement perhaps we're not so well aware of is we should consider the impact of our actions on the environment as well. So it's written into our code of professional conduct. So welcome to this session. Hopefully we're going to get an awful lot out of it as we go through. What I wanted to do was to start off by talking about what college has done so far, because we very definitely made a start. And what I want us to think about, and what Ellie and Zoe are going to take us through, is what we should be doing as we go forward. So what has college done so far? We set up a working party back in 2020. Here are the terms of reference of that working party. And it was first of all to create an internal policy for college itself. It was really important that we showed leadership around that. We wanted to create a profession-facing environment and sustainability policy that we could put into action with both of college's hats. College is obviously unique. We have a regulatory activity, but we also have our more formal Royal College activity as well. So we wanted to be able to create policy with both of those. And also, we represent the veterinary profession on UK HAC, which is the UK Health Alliance Against Climate Change, which is a collaboration of all the medical Royal Colleges that help lobby government around climate change. We also wanted to make recommendations around our potential new college initiatives and put support in place for existing complementary projects led by other organisations. So that was the terms of policy of our working party. This is what we've achieved so far. I think this is a tremendous credit to the Green team at the Royal College that we actually are bronze members of Investors in the Environment, because we actually don't have a building so far. So to actually get that far, I think, is tremendous. The Green team at college is amazing. They're active, they're engaged, they're driving sustainability throughout the whole of the college executive, and they do all sorts of fantastic initiatives to help with that. They have their Green Zine newsletter. The The other thing which I'm really proud about is Royal College Council agreed for college to divest from fossil fuels, which we have now done. As far as external policy was concerned, the great way to be able to do that was through our practice standards scheme, and the new changes to the practice standards scheme were agreed by Council back in June 2022, and we have new and amended core and GP levels for environmental sustainability. Those cover all sorts of things, but just to pick out a few of those highlights, things like stocking of drugs within pharmacies is obviously important. Prescription of drugs, obviously around the necessity to prescribe antibiotics, of course, we're well aware of that around many of the campaigns that's already ongoing, but also the prescription of endo and ectoparasiticides to companion animal, production animal and equines to justify their prescription on an individual basis and on a risk-based approach. Sustainability policy has been built into the core standards for practice standard scheme, and I was delighted to see last month that Vet Sustain have actually produced a really excellent template to help people become compliant with that. Looking at things like equipment maintenance, looking at things like doing waste audits as well. And of course, the other thing that we've also introduced is the new Environmental Sustainability Award, which was launched this year. And we've already had practices that have taken it who've been absolutely outstanding and have been awarded that. Other things that we've also done, I've already talked about UK Hack, and we're very active with UK Hack. We've contributed to much of the work that's been done. One of the things that was published just last week was the Green Surgery Report, and we're going to hand the baton over to the fellowship in order to continue that work, to critically look at that piece of work to see what we can cut and paste and use in the veterinary sector and where we need to perhaps adapt it for our veterinary work. We've also contributed to their biodiversity, climate change and health policy report, and we're also signatories to the 0 Hour letter which went to the Department of Health. RCVS knowledge is amazing. I think Pam's here today. We've got representatives from RCVS knowledge. They have done a huge amount of work around antimicrobial resistance. They have Vet Team AMR. They launched Farm Vet Champions in May 2021. Their AMR Hub was launched later that year in November 2021. They've got their Farm Vet Champion Smart Goals, which were May 2022. They collaborated, I mentioned it earlier in my address, around antibiotic amnesty. They provided the resources that are housed on the Knowledge website as a reference for people to help support that whole campaign, which has been really, really invigorating and fantastic. And then just this year, they've launched their companion animal and equine vet team AMR platform. So they're doing a huge amount of work. They're the charity partners of college. College helps support them in their work, but they're turning out some fantastic pieces of work. So that's my brief introduction. I don't want to hog the stage because I want to give the opportunity for Zoe and Ellie to talk to you. What I would like you to do, if you join Slido, hopefully, I want to start by asking a question. I've told you what college has already done, but what we want to know is what else we should be doing. And what I'm hoping, if you go onto Slido now, we should have a word cloud. I'm reliably assured. I want you to put into that word cloud for me words that you think are appropriate. What should we be doing as a college? What are our top priorities? So put in some words for me just to give us a feel for where you think we should be going. Should it be pet food? Should it be anaesthesia? Should it be plastic free? Should it be appropriate use of drugs? So just give us a feel. Let's see what we get. And then what I'm going to do is hand over to Ellie and let Ellie take over. Okay. Interesting. Keep them coming, folks. Do you want to come, Ellie?
Yeah, in this kind of fascinating space where I kind of want to see what you guys are saying. The focus of what we want to do today is to empower and inspire you, the fellowship that has come to this session. I honour you for doing that. Thank you for coming here. We hope that we're going to give you the framework between Zoe and I, based on our knowledge of the work that we've been doing, which we'll go through. What I think is really important to understand is what your role in this is, whether that's your personal role or your organisation's role or your ability to control or your ability to influence. For that, it's going to be different for everybody in the room. And as you can see, there are a whole range of things, oh my goodness, that we need to do. So I think we'll perhaps show this slide back at the end. Please keep these answers coming in, and we're going to pose a couple of other questions. And we want those answers to be coming in because this is going to feed into some more work that we're doing across RCVS. So, super. So this is going to be a very, very, very quick whiz through. I'm happy to share these slides. What I'm trying to give you is a sort of framework to hang all of this off, because I think that when you think about sustainability, you probably feel a little bit like that word cloud, where it's just bing, 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 and you don't know where to start with it all. I certainly felt like that when I started on this journey. So there are a lot of things going on. Sue's already gone through these, of the kinds of RCVS activities. I want to pose a question. What if the carbon efficient veterinary healthcare that we provide improves the mental and physical health of owners, such that we as a sector have a net positive impact on carbon emissions? We're not talking about reducing our carbon emissions, we're talking about turning it the other way and saying, by owning a pet, by being involved in the agricultural sector, by doing all the things that we do as a veterinary sector, we can actually have a net positive impact. What if that's possible? What if by the careful management of the land and the animals and the green spaces around our practices and on the farms that we work on, that we can have a protective impact on ecosystems and actually have a net positive biodiversity gain? What if? What if we can do that? And what if we understand causes of disease and infection control so well that we don't need the resources that we currently use in order to prevent and control diseases? What if? And that's the future that I want to head toward. So I am a veterinary anaesthetist by training. I'm a RCVS specialist in veterinary anaesthesia and analgesia. And a few years back, I sat my exams and then had a load of spare time on my hands, and I thought, what should I do with this time? And it had been bubbling away in our practice that we probably ought to do something. And again, it was that something piece. What should we be doing? And the more I did in my practice, where I'm a clinical anaesthetist, the more people said, why are you doing this? And I said, oh, thank God, are you volunteering? Great, good. Oh, you're not going to do it? Oh, well, I'll keep doing it whilst you're not doing it. And I think it's that attitude that we all need to have. We are all chief sustainability officers in our own field. So the question is, what are you going to do? And I think that what we have to understand is what our framework within the vet sector, and that's what I can present today. I work for Linnaeus, which is a part of the Mars Vet Health Group. So we're a global corporate. We cover small animals predominantly. So we're looking at that sector. Now, you'll have to extrapolate a little bit if you're working in the pharma or the equine sector, or indeed in the pharmaceuticals or in other branches. But the point is, I'm trying to give you a picture of the kind of impacts in that sort of area. And I'm happy to talk if anybody else has specific other parts. So I've been a bit on this weird journey where I'm a vet 2 days a week, an anaesthetist 2 days a week, and then I'm a environmental sustainability lead for Linnaeus, so our 6,500 associates around the UK and the Republic of Ireland, on the other 2 days a week. So it's that bridge, and I now have hold professional accreditations in sustainability. So we need those bridges. We need to upskill in sustainability. We need to become carbon literate, and we need to know what that carbon literacy looks like for us in our day jobs, in our day lives. And that's hopefully where we're on today. Now, I want to highlight that sustainability, as you've seen from the word cloud already, means something different to every one of us. And the definitions around sustainability usually cover people, planet, profit. Or you can go into the UN Sustainable Development Goals, which are a set of 17 goals. They're focused on trying to reduce poverty. And so we start to see that this is really a whole One Health picture. My role is very much planetary health. So that's why I'm gearing at everything from that angle of how do we promote planetary health through our work. And for me, I don't know how many people in the room can identify this bird. Can I have a raise of hands who knows what that is? I guarantee you that if I played the recording of this bird, you would all know what it is. And it is it's a cuckoo. Okay. So on the Aspley Guys golf course for the last 5 years, there's a cuckoo that sings in April, and they only come for about 2 months of the year. So when you hear the cuckoo singing, that's pretty cool, because you know that they're going to be come and gone fairly soon. Didn't sing this year. May be the last year I ever hear it on that golf course. And that's the kind of picture that we're seeing. That's what it means to me. It'll mean something different to everybody in this room. But the good news is, everybody in this room has such a wide scope of influence, and possibly a wide scope of control as well, that if we work together, we can start to solve some of that word cloud. But my ask of you is be cautious in picking what is in your control, what is in your influence, and then focusing your energy and working in collaboration with other people who are in overlapping fields, such that we're not working against each other, but we're working together, because that's what it's going to take. It's a wicked problem in the words of management speak. So we have a question. The first question I want to ask, if we're able to switch to that first question on Slido. I'll have to see what it is because I can't remember exactly what it is. I know roughly what it is. So I want to ask broadly, we are the fellowship in the room, what impact does the UK veterinary sector have on the environment and planetary health? And I'm just talking about planetary health. I'm saying that with the knowledge that with planetary health, there's a big aspect of climate justice. We need to make sure that this is fair for everybody. We need to help developing countries come to the quality of healthcare for animals and for people as quickly as possible. But I just want to focus on planetary health. And the second question I want to ask is, what do we not know? Because in terms of the goals of fellowship, which is scientific advancement, through our expertise and our knowledge and our ability to collaborate and educate and research, what we don't know, that's where we can fill the gap. That's what I want you to turn your mind to. Okay, so that's going to keep going and we're going to come back to that. May we go back to the deck? So keep those things coming in. As we go through this framework, keep those coming in. As something comes up in your mind, keep it coming in, because we will share those, we'll feed it into other work, and this is the kind of inspiration that we need. So there is a framework created by the Stockholm Institute in Sweden, which talks about planetary boundaries. And they say that there are boundaries of key geophysical processes, which if you cross, it is no longer safe for humanity to exist. So we're talking about safe planetary boundaries for humanity, not for the planet, not for animals, but for our species. And they've actually added a new boundary now, so there are 10 boundaries, and of the 10 boundaries, in 2023, we have crossed 7 of them. We have made our safe operating space unsafe through our activities. And these are covering things like climate change, biodiversity loss, novel entities, that's microplastics and chemicals, covering land system change, so how are we using the land, nitrogen, phosphate flows, a whole wide range of things. What we know is that these planetary boundaries, they all interact. So if you destabilise biodiversity, you destabilise climate change. This becomes obvious if, for instance, you are changing your use of land of peat districts and taking them out, you're taking a carbon sink away. Or if you're changing mangrove swamps, you're taking away climate, and you're also taking away biodiversity, and you're also taking away land protection. So all of these key areas are linked. So you might use this framework to try and pick out where are your impacts and where are your key areas of activity. So we are increasingly operating in an unsafe space. And I tend to put it into these three categories. So we've got climate change, not state of our sector, biodiversity loss, and resource use. So those are the 3 key threats that we've got. The kingpins of those 10 planetary boundaries are climate change and biodiversity. Those are the 2 that you really need to protect, because all of the others will interact to destabilise those, and those are the ones that if they topple, you're in trouble. So climate change, biodiversity loss, and resource use. And you can call it resource overuse, you can call it waste, you can call it resource mismatching. The upshot is we're using too much of stuff. And everything that we have in this room comes from nature. It does. We are from nature. Everything in this room is from nature. Everything that we're using day to day is at some point coming from the resources that we have available to us. And we're using too much of them. We're using them in a bad way. So this is from Dr. Kim Nicholas, who's a climate scientist. You can tell she's a climate scientist because she's given you the summary and then she's referenced everything. So point number 1, planet's warming. Point number 2, it's us. Point number 3, we're sure it's us. Point number 4, it's pretty bad. But point number 5, we can fix it. We can fix it. Will we fix it? That's another question. So my question, again, to the room is, how are you going to take this forward into something meaningful? And this doesn't mean you have to become a sustainability professional like me. It means you have to integrate something of sustainability into your day-to-day job. From this presentation, pick your fave and carry on. If we're looking at carbon emissions for a healthcare sector, this is a graphic which is from the NHS. And broadly speaking, this maps against the kind of graphics that we're getting across Mars Vet Health and LNS. If you were in a farm animal practice, you'd have far more of the picture coming from agricultural impacts and maybe from car and from transport, so just to level it out. But broadly speaking, what I want you to pick up is that the green stuff, that's your direct impacts. That's things like releasing anaesthetic gases, burning oil on sites to run your heating. It's your travel, business travel. The blue stuff is everything that you procure, supply, everything upstream, everything downstream. And that tends to be not the control stuff, but the influence stuff. And pretty much for every sector that's out there, the stuff you can influence has a bigger carbon footprint than the stuff you can directly control, which is where, again, as a regulator, as a vet sector, we have more potential if we work together to be informing the sectors that we work with, this is what we need from you. But the two big areas that I want to pick out are, and this again maps quite closely, is that for the NHS, 20% of their carbon footprint comes from medicines and chemicals, and 10%, it's actually more if you take it into, about 20% comes from equipment. So I'm sure that day to day you guys are handling medical equipment and medical pharmaceuticals. This is billed as the net zero surgery session. I don't need to talk to you about procuring green energy because it's not in your day-to-day jobs. I don't really need to talk to you about segregating your waste correctly. You should be doing that. That's a duty of care under law for every individual in this country. What I want to talk to you about is what is in our unique influence and unique control, which is stewardship of the medicines and the stuff. And the stuff is, Zoe will come on to. We need to be reusing more. We need to show pharmaceutical stewardship. That's where I think fellowship can really lean in. Biodiversity loss is pretty critical. Our food comes from the pollinators. We don't have pollinators. We don't have food. Cone snails. These are a species that produce hundreds of thousands of peptides which have unique properties. One of those peptides has been identified as an analgesic, which is 1,000 times more potent than morphine and non-addictive. Wow. These things are incredible. They live in the coral reefs. We carry on with climate change and biodiversity loss at this rate. They're gone. We've lost that as a resource. I think that's devastating. The study I want to pull out here is, we know that parasiticides is an issue which is in the press a lot at the moment, and it's something that we're becoming increasingly aware of, and Sue mentioned that it's one of the things that's gone into PSS. But I want to dwell on not just one type of drug. Antibiotics we know are an issue as well. But if you sample water from global waterways, rivers around the world, 75% of the rivers have a pharmaceutical in them which is hazardous to human health in some way, whether that be endocrine disruptors, fungicides, non-steroidals or anti-inflammatory medications, antibiotics. So it's not just one drug that we've got a problem with, it's all the drugs mixing in together and all the chemicals mixing in together. So we have to show stewardship across the board of all of these things. We know which are the key problem areas. We know that they're out there. We know we need to do something about it. Resource overuse. A lot of people talk about population. I just want to highlight this stat, which I quite like, which is that world population has risen 7-fold, but GWP, which is kind of linked to the resources that a country uses, has increased 450-fold. So again, there's this mismatch between our consumptive patterns that needs to be adjusted. And with the evidence base that we can access through RCVS, through knowledge, through the fellowship, we've got the power to do this, and we should be doing it. We specifically in healthcare, the Green Surgery report, which Zoe will touch on a bit more, identified that there's 1.5 times variation in spend for similar clinical procedures in the NHS. I guarantee if you go out to practices, you will find different clinical practices for similar clinical situations, and therefore different resource use for the same clinical situations. And things like the Protect Me campaign is trying to bring in some standardisation whilst allowing clinician autonomy to treat their patients as they see fit. We need more of that. We need it not just for antibiotics. If global healthcare were a country, it would be the 5th largest carbon emitter in the world. So these impacts are not insignificant. And the NHS contributes something like 4%, I think it is, 3 or 4% of all of the carbon emissions in this country. And they say that 1 in 20 vehicles on the road are on NHS business. So if you think about the scale of our sector, we don't have those data yet, but it's entirely possible that we have similar impacts. Why should we do this? We have a duty as an individual. We have a social duty. People often talk about, yeah, but it's people versus the planet. Do we help people or do we help the planet? Actually, again, climate justice, we're talking about do we help people in this country by reducing our consumption, or do we help people in developing country who are living with the impacts of climate change and biodiversity loss? It's people versus people. So we need to reframe this a little bit, because there's a big healthcare emergency going on globally because of climate change and the ecologic crises. We also have legal duties, but I think more importantly, we will not be able to continue working as we do if we don't do something about this. So all of the great knowledge that we have in this room will be redundant if we can't do any of our work because we haven't got the stuff to do it with. So we need to be a bit proactive about this. This is a vet practice. It was brand new. It was flooded out within 9 months of being built. £9 million hospital. Lots of other organisations are doing stuff. Royal College of Anaesthetists has a big sustainability report. Mars and a lot of the other corporates, Mars has a net zero roadmap where they're looking at 50% emissions reduction by 2030, and that's a funded scale programme across all of our work. The Sustainable Medicines Partnership, so that's including most of the major pharmaceuticals manufacturers, have a very clear programme. The Pet Food Manufacturers Association have a very clear sustainability programme with all of their key pillars. Universities have sustainability programs. So, the question is, what is going to be our program? What does it look like, such that everybody in this room can be literate in saying, you know what, the problem is this big, but this part of it, that's our problem, and that's what we're dealing with first over the first 5 years. So I'm going to hand over to Zoe now, and Zoe's going to be talking more about the stuff part of the footprint. Then what we're going to be moving into is, I've got 3 core questions. If we only get through 2 of those, that's okay. And we're going to be looking to get answers from you guys as what do you think that we can do, given the framework that Zoe and I have provided you with. So I'll hand over to Zoe.
Thank you, Ellie. So just to introduce myself, for those of you who don't know me, my name's Zoe Halfcree. I'm a soft tissue surgeon at Davies Veterinary Specialists. I am also a subject matter expert for Linnaeus Clinical Board in sustainability. I'm a director at Vet Sustain, and I'm also completing, nearly at the end, of an MSc, MSc in Sustainability and Behaviour Change at the Centre for Alternative Technology in Wales. So this is a really timely session, as Sue has planned, because earlier in November, just a couple of weeks ago, the UK HAC, the UK Healthcare Commission Against Climate Change, released the Green Surgery Report. It was released just a couple of days before the London Vet Show, and we had the pleasure of sitting on a panel with the chair of the report, Professor Mahmood Bhutta, and discussing this report with the profession. The report is a 116-page document which basically looks at how healthcare has impact upon the environment and areas where we can reduce that impact. It is 116 pages long, but there's a great executive summary and there's a great sort of concluding area, basically with recommendations for how people in different sections of the healthcare sector can make changes. So it's definitely something that I would recommend looking at. It is endorsed by RCVS, which is amazing to see that RCVS is there among all of the other healthcare organisations. Now, my focus is going to be on net zero surgery. Sue and Ellie have framed the picture. We're really looking at how can we carry out surgery, which is one of very, very common practices, with reducing our impact upon the environment. Now, you've already seen this figure. Ellie showed this. This is from the NHS, looking at the carbon footprint from the different sections of the NHS. And the really key aspect is that the supply chain and the procurement of resources, so pharmaceuticals, medical consumables, they really are the biggest sort of percentage of the carbon footprint of the sector. And so that's where we really have to consider what our resource use is and rationalise it. In 2020, there was a couple of very important papers published on the principles of sustainable surgery. These were published by Chantal Razan, who works in the Centre for Sustainable Healthcare and is a practising ENT surgeon within the NHS in the UK. When we look at the pyramid for the principles of sustainable surgery, the base of the pyramid has really key aspects that we can relate to also within the veterinary sector. The fundamental part is surgical disease prevention. So within the human sector, this is talking about diet, it's talking about healthy lifestyles, as Ellie has also touched upon. I think we in our sector could also consider perhaps about breeding and knowing particular breeds are more predisposed to certain disease conditions and whether that really plays a role in how we reduce our carbon footprint as a sector going forwards. There's also then patient, or in our case would be client education. But the really key one to think about rational resource delivery comes in the middle of the pyramid and higher up here, where we're talking about lean service delivery. Now, in a separate paper, Chantal Razan produced a blueprint for lean service delivery within surgical service provision, which is outlined within this summary here. It's really nothing complicated and is something we all strive to achieve in all of our everyday practice, trying to be more efficient with the time that it takes to maybe to get a patient prepared into theatre, the time that the surgery takes, what efficiency we can improve. Whilst it's something that is already on our radar, there's always potentials for us to improve in that regard. An even more important one, which I'm going to sort of focus upon now, is thinking about the reuse to try and decrease that environmental impact from the procurement of single-use resources, which we have to be sort of honest about. Over the last couple of decades, we have seen a transition within the veterinary sector from reusing a lot of items to an increasing level of single use. Now, there are lots of different reusable alternatives that we can use to try and decrease our environmental impact from their procurement. And this image shows just a few examples. We're looking at a reusable surgical sterilisation tin so that we don't need to have a lot of wrapping, potentially a reusable apron for someone who's in contact with a patient that it doesn't have any sort of cause for concern with regards to infectious disease, and that could potentially be wiped down between patients. Reusable warm air devices, reusable scrub hats, reusable incontinence sheets, reusable sharp spins. That was something that really struck me, was understanding that there were systems of reusable sharp spins, so rather than the whole of the yellow sharp spin, the plastic bin that we're very accustomed to seeing being collected once it was full and the whole thing being incinerated. There are services where you can have a reusable sharp spin which decreases cost and decreases the carbon footprint of their use. But I think a really important area that we have to consider are the trends that we've seen in the use of surgical textiles. Now, I know that everyone within the room will have their own experience of what they have seen in their own practice and in practices that they've supported work within. But we definitely have, over the last couple of decades, seen a transition from the use of reusable surgical textiles to much more commonly single-use surgical textiles being used. There isn't a huge amount of data actually clearly available, but if we look at what is published, in a publication by Delliser et al. In 2012, which was looking at UK practices' use of draping, their draping practices. 66% of practices then used reusable drapes. And then I was involved in supporting a final year student at the Royal Veterinary College a couple of years ago, doing a similar questionnaire-based study, and we'd seen quite a change to only 28% of practices then having reusable textiles, and sort of an increase in the amount that use single use. In my personal experience, within a referral setting, it does tend to be single use that we're using. I'd be interested to hear what other people within the room are using in their practice. But interestingly, when there was a supply chain disruption during the COVID pandemic, and quite understandably, the gowns were diverted for human healthcare as PPE, and then that did lead to an increase in reusable textiles to provide ongoing emergency care for our patients. An interesting observation is that where reusable textiles are used in veterinary practices, there is little evidence of rigorous monitoring for the number of times those textiles are reused, which would be a recommendation for maintaining quality controls. That's something that also needs to be considered. Now, why did we change to using single-use textiles? It was because of improved quality assurance and trying to assure that we have the best standard of care for our patients and for our clients. And it was also, I believe, to sort of emulate the standards of care that are provided within human health care. But I think what we have to consider is what actually is the evidence for the use of reusable versus single use when you come down to talking about surgical site infection rates. Now, there's clear published evidence that everyone will be aware of that the traditional sort of cloth surgical textiles have very poor barrier properties once they're wet, and that they bacterial wicking is demonstrated in vitro, and therefore there's a concern that with those you have an increased surgical site infection risk, which we absolutely don't want to have that. And if we're to just switch for a moment to thinking about sustainability perspective, there would be actually a much greater carbon footprint if we were then treating a patient who developed surgical site infection from our care. So we really have to maintain our concerns about optimal standard of care and the quality of care for our patients as the utmost. But we need to go back and have a look at the evidence, and that is what has been done within this green surgery report published a couple of weeks ago as well. If we look at a systematic review of the literature, probably the most thorough review was performed by the World Health Organization in 2018, looking at all of the published literature comparing surgical site infections where reusable or single-use surgical textiles were used. There's no difference in actual surgical site infection rates that are published. There will definitely be papers that we would know of, that we could find out there, where there are discussions between different types of drapes, and one might be shown to be beneficial over another. But their conclusion, looking at all of the evidence overall, was that there is no clear evidence of a difference. A really important further thing to consider is that when we're talking about reusable surgical textiles, we aren't actually talking about the cloth drapes, the cloth gowns that most of us were familiar with when we first qualified, or some people may still be using, and a fair proportion of people still are using in veterinary practice. Actually, modern reusable gowns have been demonstrated clearly in research studies to have superior material properties than their single-use equivalents. So we have to consider what we're actually talking about. We're not necessarily talking about the cloth gowns, although when we look back at the evidence where cloth gowns are included in many circumstances, there actually is no increased rate of surgical site infection. What is clear when we're talking about the equivocal evidence for surgical site infection is that it is very different when we come on to look at their environmental impact. This graph is taken from a paper by Vozala et al., which was published in 2020 in the Journal for the Perioperative Association of Registered Veterinary Nurses. And this was a life cycle analysis looking at single-use surgical textiles compared to reusable surgical textiles. This is looking at specifically at a surgical gown as an example. And it compares 4 aspects of environmental harm: the amount of energy that is used, the global warming potential, the water resource that is used, and the waste that is generated at end of life. The full bar here is the impact of the disposable gown that is used, and the reusable counterpart has just a fraction of impact over these 4 different aspects of environmental harm. So this life cycle analysis very clearly shows that by changing to reusable textile systems, we can dramatically reduce our environmental impact. Now, a really key thing to emphasise is that because this is a cradle-to-grave life cycle analysis, for the reusable gowns, that covers all of the laundering, the reprocessing, the re-sterilisation. So it's really key. I've so many times, before I sort of got more actively involved in sustainability, I've looked at the amount of waste we've generated at the end of a surgical procedure and had a conversation with a colleague and said, you know, I just feel there's just so much waste and it can't be, you know, this can't be right. And we've sort of had a discussion and someone would say, well, when you think about the laundering and the sterilisation, it probably all balances out. And I sort of accepted that for a little while. And I was delighted to see this paper, which actually made it totally clear that the environmental impact is far, far greater for us using these single-use items. Now, that's not to say that we should never use them, but we really need to be rationalising when we're using them, much like we're talking about antibiotics. We need to have a rational use of our single-use items. And we also need to go back to saying, well, actually, maybe the modern reusables, the standards of those are in some cases higher than the standards of the single-use items that we're looking. So we need a greater understanding of the resources that we're using because they're impactful. Now, I have taken some really interesting case studies out of the Green Surgery Report published a couple of weeks ago. So this is the report that I mentioned at the beginning, and each of us have mentioned it today, because there are really interesting case studies in human patients in the NHS where changes have been made to reduce their resource use, reduce the carbon footprint, and reduce the amount of cost spent upon these single-use resources. Now, this is an example from Leeds Teaching Hospital, NHS Trust. Patients undergoing laparoscopic appendectomy, they changed from the use of single-use to reusable gowns and drapes. And so sometimes I've also spoken to colleagues where they said, oh, but in humans, they'll never be made this transition to reusable textiles. But no, it's happening. It has happened. And we need to make sure that we are also doing the same or continuing to use reusables if that's what we are already using. Even more interestingly, a specialist orthopaedic and breast surgery hospital performing total hip replacements or equivalents also have switched from single-use to reusable equivalents for gowns and drapes. Now, I felt that some of our specialist orthopaedic colleagues would be surprised by that, but it's just interesting to see that provided we have the right process of laundering, reprocessing, and ensuring the standard of sterilisation, these reusable devices are considered to be of satisfactory quality to be performed in, you know, total hip replacement. I thought that was a really interesting observation. There are then other examples where simply a procedure is sort of rationalised further, something specific like a carpal tunnel decompression where there's a sort of small surgical area, reducing the size of the drape. So there's a fair amount of discussion of moving from sort of like operating theatre sterility to more field sterility. So if there's a small area that we're working on, do we actually need to be fully gowned with 4/4 draping, or actually can we be more rational with what we need? And I must emphasise that at every step we need to ensure optimal quality control, so we don't want to have any sort of adverse outcomes. But it's interesting to observe that these changes are being made within the National Health Service. And you can see, again, carbon saving and cost saving as well. Now, within the NHS, in order to be able to achieve this, there has had to be a reintroduction of the sterilisation services, because when there was a transition to single-use textiles and often single-use instruments, which for single-use instruments was related to concerns about the potential transmission of Creutzfeldt-Jakob disease, which has now kind of been demonstrated to be of very, very low or insignificant risk, particularly if there's proper processing. They recognise the importance of needing to have the sterilisation facilities, and a company called Revolution Zero have set up decontamination services actually on site there, local to the individual hospital. And this sort of addresses the potential of the supply chain issue. When we think about the COVID pandemic and those of us using single-use surgical textiles were running out of those textiles. A similar thing could happen due to all sorts of sort of disruption of supply chain, potentially related to adverse weather events and climate change and various other factors. And knowing that there is a local service that can provide high quality levels of laundering and reprocessing is essential, basically for business resilience as well. Now, I've mentioned a few times that any change that we make for sustainability must not impact upon the quality of care that we're providing. And this concept of sustainable quality improvement is one of the domains of quality veterinary healthcare, to be sustainable, abbreviated to SUSQI. Within the human medical sector, there are educational programs in SUSQI, and there's been really positive sort of uptake of this concept, and it's been recognised that combining the sort of aspect of sustainability alongside other aspects of quality improvement gives a different lens and a different focus and enhanced motivation for engagement with both. Now, if we're anywhere on the behaviour change aspect of moving to net zero surgery, we may be only here, aren't we? Or maybe could we be, some of us, sort of creeping up this curve, which is the diffusion of innovation curve for how sort of a population takes on a behaviour change. Interestingly, only 0.12% of all climate change research has been allocated to social sciences, when actually what we need to limit global warming to 1.5 degrees is a deep alteration of attitudes, norms, incentives, and politics. And so the sort of that, how do we overcome that barrier to change, is a really important aspect of how we move forward from this position. In addition to the Green Surgery Report, there was already last year or this year published the Intercollegiate Green Theatre Checklist. And again, following what Sue has said, we would like to have a look at this and see how we can adapt that to support the veterinary sector in a transition to net zero surgery. That's the end of my part. Thank you.
Thanks, Zoe. And we want to plug, if it's okay, if you are interested in joining the working party or the discussions around that veterinary version of the Greener Practice Checklist, we've got a little sign-up list. Please come and sign up, and this is not signing in blood for hours and hours of commitment. Sometimes it's just to be another pair of ears or eyes on the process, or to be aware or in the loop of what's happening. So if you want to be in the loop of that, then please do let us know, and we'll be working on that project over the next year or so. So it's how do we create a greener surgical checklist that is applicable for the veterinary profession. So please do sign up there if you're interested in that, and we'll leave the sign-up sheet down here somewhere.
At the front, yes.
At the front.
Thank you.
Okay, super. Okay, so this is the bit where we want to talk to you guys. I want to pose, I've got 3 questions to pose. I think we're going to try and keep it to about 10-15 minutes, and we may not get to the third one. But what we want to be thinking about is how can fellowship as an organisation, but you as participants in fellowship, can move this agenda forward. So can I move on? Oh, I've got the slide thingy. I can move on. Okay, so we know what the RCVS's role is. We know what RCVS knowledge does, promotes and advanced knowledge. What does fellowship do? And what we want to look at is what don't we know, and how could fellowship fill those gaps? How can we use the mechanisms within fellowship and that we have access to fill these knowledge gaps? So one of the Slido questions I think that you should have access to now is what don't we know? Please populate that with things that you, in your area of influence, expertise, activity, would need to know. What needs to be true in order for you to change the behaviour, change the process, change the pattern? And I want to just move on to a particular question which I think is a big issue. So Zoe talked about this kind of cascade, and really what we need to be doing is looking at this bottom level of how do we prevent patients entering the surgical suite where the energy use, resource consumption, pharmaceutical use is 3 to 4 times any other part of the hospital. So how do we prevent them getting to surgery in the first place? And that's where I'd like to sort of tap into the room now and say, how can we promote preventative care versus reactive care? Now, I'm an anaesthetist, I'm a reactive care clinician. the thought of having to do preventative care for a career feels a little uncomfortable to me, and maybe it will to some of you guys as well. But we're talking, I think, in the area of obesity, nutrition, dental disease, chronic pain, breed-related conditions, optimising infection control, and promoting reuse where we have evidence base and it's sensible to do so, and improving the human owner bond with all of the co-benefits we get from that to the NHS in terms of carbon reductions. So I would like to tour the room with my microphone, and I'll pick on people who I know have opinions, if we don't have opinions coming forward. So raise your hand, or if not, I'm coming straight to, oh, okay, Kit's in there first. Kate, I'm coming to you at some point, and Carl, chronic pain, coming to you.
Hi, I'm not a surgeon, so I'm scot-free already, but for me, the biggest thing would be non-surgical neutering. We could save 2 million surgeries in this country if we could get to non-surgical neutering, and I think that would have an absolutely massive impact on our surgical waste.
So what discussion, what's the barrier to that happening straight away?
Well, it's the research to developing effective drugs. They are out there, they are coming, but I don't think there's enough push or pull for them to reach conclusion.
Right, so this is research collaboration with the pharmaceutical sector and academic institutes and clinical research, RCVS knowledge.
Can I just come back on that one? From an animal welfare point of view, why do we need to everything automatically anyway? We don't need to. So there's an education piece with the public and with veterinary surgeons who were taught that you should to everything when I went to college, but you don't need to. So there's a question mark on that, especially for dogs, less so for cats.
So the behaviourists need to get in on the game and talk to the surgeons. Oh, it's always uncomfortable, but you know, welfare. Okay, I'm coming to Carl on chronic pain. So I feel that chronic pain is an area we need to get into a bit more.
Thanks, Ellie.
A lot.
A lot. I thought you might come over. I think we started that conversation earlier, didn't we, actually, around how we can provide better education around chronic pain as part of this. But just thinking about some of I thought one of the really nice gentlemen here talking about the cruise ship rupture this morning as part of that conversation. How do we stop them from getting to that point where we need to intervene? Could fit in with the neutering component as well there. So can I just put a couple of other things, actually, just thinking about it on two hats. So one as clinical director role, thinking amazing, I love the idea about all of the waste that we produce and how we can really focus on that, and seeing how we come out of theatres with buckets of single-use items, and fantastic to hear that there's opportunity there. And the other bit around anaesthesia and how we can focus on, I think education's the key there, to engage with the rest of the profession to do that.
So the Green Practice Checklist we're trying to pull together, it's being led by the AVA, but also ECVS, ECVN, and anybody else as any part of organisation that is a stakeholder and is going to be a key collaborator in that. I'd like to pick on John Innes, if I may, and sort of say, how do you feel about wearing a reusable surgical gown? Are you sitting there going, no, I'm not on your Nelly, that's not happening?
No, I'm very open-minded to that, because I'm old enough to remember the first time round. But, you know, I think there needs to be a real strong push on that, because absolutely right, the amount of waste that we create in an operating theatre is unpalatable, yeah.
I often say to people, let's try this, and then I want to hear your feedback. And you give people a month of trying something new, and then you hear the feedback, and then you hear what the actual barriers are. And one of my questions when I talk to surgeons who talking about trying reusable gowns is, have you looked at the standard that your current gown is meeting? And if you haven't, then how can you say that my reusable that meets the ISO and British standard is any less than yours that you don't even know the standard of? So it's just kind of being to go, oh, okay, I hear what you're asking. Are you asking, am I providing the good quality already, and can I provide quality in a different way that happens to be more sustainable? So I think it's a conversation, but I can't lead that because I'm an anaesthetist, you see. We need surgeons on board as well.
Yeah, no, of course, university departments, teaching students, that's the way that change will come about, is through their education. But I'm very open-minded to it. I hope other surgeons in the room are too.
Feel free to put your hand if you are. I want to come to Kate, because... Oh, yeah.
Just one other thing is I've recently been locuming in referral centres, and I was astonished to discover that some surgeons double drape everything. So they're not just using one set of single-use drapes, they're putting another set over the top. I don't know where that comes from. I'm a bit old-fashioned like John. I'd be perfectly happy to go in with a reusable one.
So we broached this with our soft tissue surgeons a while back, and they said they were prepared to cut a hole in one big drape rather than use 4 quarter draping, which I don't know if that's possible in orthopaedics. I don't hang around once I put the block in for TPLOs. But there's ways sometimes there's not an immediate or there's a barrier in place that means that nobody's comfortable to quite switch it straight away. Elvin's going to chip in. I'm coming back to you, Kate. But we can approach things in different ways. So, for instance, in terms of autoclaving, most people will double bag autoclave systems. Our sterile services team wasn't happy to switch from double bagging instruments straight away, but they said we're quite prepared to prolong the interval between re-sterilising by another 6 months. So now they only re-sterilise every 12 months, which means that we reduced our packaging by 50% that way. So there's ways. Elvin.
I have to admit I'm probably guilty, one of those orthopaedic surgeons who has double gloved when I'm doing certain procedures. And one of those is for hips. I think orthopaedics can be quite unforgiving when it goes wrong, but I am more than happy to try a reusable gown or do something different if it will decrease waste, as long as the evidence is there. I guess it's really that mind shift of how we were trained. And when we have seen some of the complications, we do everything that we can, or we think that's right to reduce those complications. But I guess going back, where's the evidence coming from?
And it will take everybody in the room to generate this evidence. The other thing I'd like to highlight is that everyone in this room has the potential to be a leader. We may not all be managers, but we can be leaders. And I think by virtue of being in this room, you probably are a leader. And so when people see you doing stuff, they will follow you. So please do take that opportunity to explain to people what you're doing and to make the point of being a leader in it. Now, somebody had a question over. Oh, there we go. We're coming over here. Super.
Hi, my name's Rachel Dean. I'm interested in evidence-based medicine. I currently work for Vet Partners. Just to share a project we've got at the moment, funded by us and by Pet Savers. Thank you, BSAVA. It's called Project Drapes. Clues in the title. You can Google it, Project Drapes Vet Partners. And we're running a randomised controlled trial from primary care, looking at surgical outcomes to do with reusable drapes versus the other ones. We did this because we did a whole piece of work looking at our complication rates to surgery. So we now know them for neuters. So we know our current outcomes. And so we're using that as a clinical outcome, but we're also looking at that life cycle thing. I'm not a sustainability person. We have published the protocol, so anyone can find it in the Open Science Framework, or you can just email me or anyone at Vet Partners, and it would be lovely to extend that further. We have enough power across our business, but extending it to other surgical procedures, we have a potential blueprint for that.
And I think we need that clinical research going on as well. Bearing in mind, we're on preventative care at the minute, but I've another topic to come back to Fergus and Ian. You're not out the spotlight yet. Here we go.
Hi everyone, Emma O'Neill from Dublin. I wonder whether it's time for us to get a little bit more vocal about considering particular breeds, because the impact we could have from an animal welfare point of view and using the sustainability angle to educate clients, I think we could bring people along with us if we actually started to really embrace bringing both of those angles together, and it would be a very good thing from the profession point of view on several angles.
And again, I think there's some research out recently about lifespans for different breeds, and and that all feeds into the human-owner bond. If you're having an animal that is constantly visiting the vet, is constantly ill, is actually not having a good quality of life, that's not good for the bond either. And bring in the carbon footprint angle.
You could actually bring people along, bring the welfare aspect, and elevate the profession's image with the public by embracing multiple angles at once.
Yep, I agree. Kate, can I tip in from a university's point of view? How can the universities help to teach preventative care? Can it fit into the framework?
Hi, Kate White from Nottingham. We have sort of sustainability embedded through the modules at the university, but I think also we need to speak to our accrediting bodies, so AVMA, EVE and RCVS, because often they are thinking things like the single use are sort of gold standard, and they want that demoed to the students, and actually we need to lead on the sustainability side as well and demo that to the students more than anything. So.
And in terms, I know you've had conversations with Chantal Rezan from the medical sector.
Yeah, I think that I've been in touch with Chantal about quite a few things, and I think what was good was she showed the mistakes that may have been made in the medical sector and has given us some good ideas about what we shouldn't do in the veterinary sector. So I think we're in our infancy, but she's given us really good pointers on how we should go about things. The other thing to say, it would be quite nice on I mean, I would love to know on a bill that goes to an owner the actual cost, but also the carbon footprint of that procedure. And actually, if we can develop some apps so that you can actually look at the carbon footprint of the drugs you used and the consumables you used, we could then catch up with the medics, because Chantal did some of that work that actually Zoe presented in her talk as well. So I think, we can get there quite quickly if we can get some money into research, which is the main sort of stopping point.
Brilliant. There's one more question here, and then I do want to move on to the next thing. Zoe, do you mind flipping on to the next question?
John Walmsley, equine surgery. I think equine surgeons, the one next to me here, are guilty of probably the worst waste of any of us, particularly colic surgery. So my view would be to firm up the evidence, circulate it more widely, educate the surgeons, put it through the surgical colleges, and then infuse it into the checklist and into the practice standard scheme, so it becomes a regulation.
And I think that you're picking on, the different angles of our profession that need to collaborate, and I'm hearing that we've got a role for the European colleges as well, not just the Royal Veterinary. So this is becoming something that our FRCVS could lead, that then has international impact, which is so powerful. So the next question I just want to pick your brains on really is, where can we promote sustainable prescribing practices? So this is paraphrased from Ian's slides, prescribing where appropriate rather than just in case. So if you ever hear anybody saying to you, let's do this just in case, that's when your bells start to ringing. Is there evidence base behind using this? Reducing wastage in the use phase, we've already talked a little bit about gowns. Using lower impact medications are the ways to do that. And improving owner compliance with medicines use. So about 50%, according to the WHO, of drugs that are prescribed to people never get used. Do we think it's similar in our profession? Very possibly. So I want to come to Ian, because you probably have a perspective on this. Sorry, you knew it was coming. You can introduce who you are.
Yeah. Hello, everybody. For those of you who don't know me, I'm an internal canine and feline internal medic by trade, but I'm currently pharmaceutical stewardship lead for Mars Veterinary Health. So this is pretty much my job. My interest and passion came from antibiotic use, but actually increasingly I'm understanding that stewardship shouldn't just be focused on antibiotics, it should be focused on all drugs. When we use them, if we're using them unnecessary, there's inevitable carbon footprints, waste production and things like that, but also environmental contamination. But one of the other things I'm increasingly understanding with my new role is that education is part of the puzzle, but it's a mistake to assume that it's the only part of the solution. There's studies showing, for example, some guys in the States are doing studies on antibiotic use, and they're surveying vets on clinical scenarios. They're giving gold standard answers as per guidelines, and then they audit what happens in the consult room, and no surprise, it doesn't align. And essentially for me, that really highlights that the consult situation, dealing with clients, it involves huge behavioural science aspects to it. There's defensive prescribing, there's time, we're time poor. It's a 1 minute conversation to prescribe a drug. You fear it might be a 10-minute conversation to say why a drug's not indicated. So if you're very busy, it's the easiest solution. So things that we've got to consider in this aspect is making these changes easy. People who are busy are more likely to adopt a change if it's easy for them. But also I think with the practices that I've worked where they've developed a successful stewardship policy within their practice, culture and leadership's really important. You hear from a lot of the younger vets that they're worried about things going wrong and not being backed up. So it's important. The culture within a hospital is really important to make these things successful. So.
I think that's it's a really important thing as educators and leaders to understand the nuance around behaviour change. That my neurotype works on the basis that if you ask me a question and I tell you the answer, you'll go and do it. And that's not how behaviour change works, apparently. So we have to be a little bit more nuanced, and I think that a lot of people in the vet profession work on a similar sort of direct approach. We're not just trying to influence our colleagues, we're trying to influence our non-veterinary surgeon colleagues, the VNs, the ancillary professions that we work with, and our clients. And that's a whole different range of people, and it turns out people are different, which is a complication, I think. I want to touch to Fergus because obviously the Protect Me campaign, the BSAVA work, the antibiotic amnesty has been a success of pharmaceutical stewardship, or at least more successful than many other aspects. So what's made it successful and what are the barriers, do you think, for antibiotic stewardship?
We're not sure yet how successful it is. I think it is it's a useful tool and it's a well appreciated resource by lots of vets within the profession, but whether it achieves the right aims in terms of driving down inappropriate antimicrobial use, it's very difficult to measure because we don't have good ways to assess those metrics. I think that it is interesting how other countries in Europe are approaching this subject, and they are using a more restrictive approach to stewardship, introducing formulary restriction that prevents the use of certain antimicrobials. And I think if vets in the UK fail to adhere to the sort of recommendations incorporated in things like Protect Me, maybe our governing bodies will look more closely at whether these toys will be taken away from us in the first place.
A sobering note, but one that hopefully inspires us to take the action further. I'll come back to Kit.
Hi, Kit Serge. I'm here with my rumour head on now. I think that the one thing we get feedback on a lot is a feeling from general practitioners that they're not supported to make the decision. Because guaranteed over the whole animal population over a year, there'll be an animal that will die, which if it had been prescribed antimicrobials, probably would have lived. And we're not good enough at making sure that those people know absolutely if they've made sensible decisions, they'll be fully backed up by the thought leaders in the profession, because at the moment they think they're going to be hung out to dry. And for many, that's the reason. It's, yes, a certain speed, absolutely, but it's that fear that if I make a mistake, some specialist will get up and say, well, that was bloody stupid and that's your own fault. And if we're not prepared as fellows to get up and defend the general practitioner to not prescribe, then I think we're really in trouble.
That's a really important point.
Fiona Lovett. I actually think we're kidding ourselves if we don't recognise the commercial interests of veterinary surgeons, which our medic friends don't have. And I've certainly had many vets speak to me, and if they don't prescribe an antibiotic at a certain procedure, they don't make the profit on that drug. And I think we can't get away from that. It's an important motivator for prescribing antibiotics irresponsibly.
And I think if you look at what gets carbon footprinted, and I've said this already to some people, that we carbon footprint medicines, goods, equipment, energy, anaesthetic gases. What doesn't come up in carbon footprinting is the advice and services that we provide. And perhaps it's a question around actually charging appropriately for the advice and services that we provide and moving into upskilling so that we aren't just dispensers of drugs, but actually we're people who advise what's most appropriate from a holistic point of view. And again, it comes back to this preventative rather than reactive healthcare system, which is a change in focus, and why I say it's not just about a like-for-like swap. For we're not just looking for the green alternative, and we're not just asking our tree huggers to do it. This is decisions about the focus and the direction, which I hope we've given you a sense of today, that we all need to take to go in that direction. I've got Carl, and sorry, would you mind flipping on to the next one, please?
Thanks, Ellie. Just thought I'd actually pick up, no disrespect to Ian or to Kate for mentioning this, but this came up around this concept of what we think is gold standard care, and I think something that we probably can focus on here as a group as well is to move away from what that term actually means. And actually, I think there's a few people have highlighted in the room what that perhaps might mean to a general practitioner or those in primary care practice, and how we can move to whatever we want to call it, bespoke, pet-centred care, whatever these new terms or newer terms are. But perhaps that might be a focus on how we can then improve and change our practice. So something I'd like to focus our hospital on for 2024, moving away from what is gold standard.
So we go from sustainability to quality of care to some fairly deep topics fairly quickly, which unfortunately is the nature of sustainability. Pam.
Yeah, Pam Mosdale. Yeah, great that you mentioned the quality of care aspect, thank you. I really think it's important for people in general practice to have the confidence to do these things, and they need to see examples from other practices. Now, you saw our quality, domains of quality on there, and for our quality improvement awards, it's anything that you do to improve any of those. So it'd be great to have more examples of improvements in sustainability to those awards, which then are automatically case examples on the website. And we have got some. We've got some around a practice that stopped using antibiotics for certain classes of cat bite abscesses, and it's lovely and practical. And that's what people, I think, in first opinion practice need to see to give them the confidence to do it.
Yes, even I now know that you don't give antibiotics to dogs with acute canine diarrhoea, which for an anaesthetist I think is a big step forward. If anybody wants any more information on that, please head to our antibiotic leads. So my next question for you is, how do we develop environmental literacy in the sector to guide your clinical decision making? Zoe is doing a master's. I am a practitioner of the Institute of Environmental Management and Assessment. I am assuming that you guys don't want to go to that extreme and actually take it on as a full-time job role. So my question is, how do you get the knowledge that you need to get? How can fellowship and RCVS and our other institutions get us to the point where we are sufficiently literate that you know what your 3 top things to do are in your professional life that will mean that you are working sustainably? And I give an example. There's a vet that I work with in one of our Linnaeus practices who said, I just don't have time to do sustainability. And I said, are you doing this? Are you doing this? Are you doing this? Are you doing this? Yep, good. You're doing what you need to do. And she knows that. So she can walk away and just carry on as she is. And that's so that I'd like everybody to get to that point in the vet profession, that they know what their 3 or 4 key pillars are and that they know what they're doing with it. So my question is to the room, how do we get the sector, how do we get you to the point of environmental literacy where you feel comfortable with those key things that you're doing? I think Pam's already talked about the RCVS SUS-QI. This is the hard question. How do you find out what you need to know? How do you do it in general? How do you do it at the moment if you need to find out something, if you need to know something?
Measure it first.
Measure it, data-driven, like it, data analytic. Bearing in mind with sustainability, a lot of the stuff we don't know, and it'll take a while to get that research in the line, and we shouldn't not do things that we think are probably the right thing to do. And I always go back to the Maya Angelou quote, do what you believe to be best until you know better, and then do that. So I think that there is an element of us needing to step forward before we fully know the whole picture in this area, just because it is such an environmental and health crisis. So how do we find out things? Nicola, I know, so I'm going to pick on you, because I know that you were engaged with one of our schemes which perhaps helped you.
No, definitely. Thank you so much, Ellie. I think you were very inspirational in, like, I don't know, I'm quite passionate about the environment as well, but seeing you doing what you did at Davies was the inspiration for me to carry it on at North Downs. And I think, like everybody said, just having the information out there and making things standard practice is probably where we go. Just getting the information out there to people, whether it's through social media or through the practice standard scheme, just making it ingrained in your everyday. There's lots of people out there who, care about the environment on a personal level and they do things at home. There's lots of people where they don't do it at home, like certainly members of our team as well, and it's hard to inspire them to do something that we feel quite passionate about. So I think just getting the information out there and helping people. As somebody mentioned as well about breeding, I mean certainly, like, I don't want to ever take off another Frenchie soft palate again, but it's something that we see every day. And the antibiotics and the other surgeries that these dogs have, that has a huge impact. Like we've seen the government, banning the XL bullies. They were able to do that quite quickly. Whether we need to lead from the top and to get, breed bans, That's something to consider as well. So I think there's so much, so much we can do. Like it's a drop in the ocean.
It feels like a drop in the ocean, but it's all cumulative. And because when you lead, people are inspired by you. So your impact as a leader in doing one thing is amplified by other people doing it and seeing it. So Nicola led one of the Investors in the Environment schemes that we've got running across the NAES. So her impact was scaled across her whole hospital. NDSR wins awards or sends the information about what it's doing to other people. Their impact is scaled. Nicola gives a talk, her impact is scaled. So my question to you all is, where do you influence other people? I'm interested in the room. Obviously, Fiona through the RCVS Knowledge Farm work. Fergus is doing a lot through the Antibiotics Amnesty and through rumour also we've got represented in the room. So we are all members, or we are all able to influence other people, maybe day to day in talking to our teams. So I'm curious, where are your influences and where can you lever?
Thank you, Lizzie, Chief Executive at the RCVS. I think we try and split what we do into what we require people to do and what we inspire people to do. So we've got the basic regulatory stuff and then everything beyond that, which is part of the next steps for people. And as part of that, obviously we have a lot of veterinary surgeons doing their certificates every year, and there's the key professional skills module within that, which, and I've just had a wee double check to make sure, at the moment doesn't seem to contain anything substantial about sustainable veterinary practice. So that would be an area that we could review and see if there might be something we could put into there, which would essentially be saying that we think a knowledge of how veterinary practice should be sustainable is a core professional skill for an advanced practitioner, which would cover a lot of areas because everybody has to take that module regardless of the particular designation or certificate that they want to take. So that might be something we could look at. Thanks.
Thank you so much, Lizzie. It's actually quite brave to commit to something in a room full of people, so thank you very much for that.
Hi there. I've just got two small thoughts. Having just done Universal Design for Learning training recently, one of the things they have as their motto throughout is +1. But it's quite a powerful message because they think that if people try and decide that they are going wrong on multiple levels, they need to just restart and do everything again, and something's really insurmountable, which is what I think people feel with the environmental issue. They'll step back and not do anything, whereas if you try and give out a message of +1 and everyone making their +1, then that's actually a really powerful way of moving forwards, and then it's easier to do your additional +1s. So I think that's something that we could think about as a campaign because it's a nice message. The other thing is, I do wonder if it's got to be something that's core to the way we all practice, that actually incorporating it into education programs, that's a given from undergraduate, but actually targeting some of the specialist colleges and actually trying to get a message out that it becomes a core part of the training is going to get the message spread, and then that will snowball as well. I'm not saying that things should always be specialist-led, but I'm just saying coming from different angles, that's going to have an impact. If they need to learn about it, then they'll be more aware, and they're role modelling that when they're in practices.
And for my own organisation, I said ECVA has it in the syllabus and it's come up in exams now, sustainability. I think we've got time for one more question, and then we're going to hand back to Sue to bring it all together.
Thank you. Stuart Reid, Royal Veterinary College. We're talking about the levers that we're able to pull, and obviously working in education, you'd think that one of the big levers that we would be able to pull is educating the students. Actually, it's the other way around. We're being driven non-stop by our students. It's certainly in some areas, in green travel and everything, until it comes to their safari in Africa, you know, of course. But we're getting plenty of pressure from them to make those changes, and actually I think pay tribute to all of the accreditors, RCVS, I think it's standard 2.6, AVMA, COE, EVE as well, are all now putting sustainability into their accreditation requirements, so that's great. But one thing just to challenge a little bit, it's I know business travel is a big contributor, but nobody seems to be challenging personal travel. In business travel, I don't think anybody travels or anybody encourages travel for business where it's a waste of money. I'm not suggesting that personal travel is, but I don't think we can talk about one being under our control and not the other. There's personal responsibilities in both. Thanks.
100%. And for pretty much every sector, whichever way you look at it, transport is about 25% of the impact of an industry. And there is some natural electrification that's happening as the grid decarbonises and people move to e-cars and such. But we can accelerate that. And we can certainly look at how we're using digital conferencing and such to enhance the spread of education, the access to education. I went to VETAD this year and they said, how can conferences be sustainable? And my answer was, do something at a conference that you can't do online. That's how you make conferencing sustainable. So I hope that today we've done something that you can't do online. I've been quite enjoying it, but I suspect you guys are hungry, so I'm going to hand back to Sue.
Thank you, Ellie. It's taken us just about up to 1 o'clock. We could probably all chat for the rest of the afternoon, certainly. It's great to get the expert opinion. So before I sum up, I'd just like us to thank Ellie and Zoe for giving us their time and their expertise. Thank you, guys.